Hello students, welcome back to my channel. Today we will discuss about the cervical cancer. So what is cervical cancer? Before going to the topic, important to know what is cervix. So cervix is the lower end of the uterus. It is at the top of the vagina here, and it is about 2.5 to 3 centimeter long, and the cervical canal pass through the cervix. It allows the blood from a menstrual period and a baby to pass from the uterus into the vagina. So here you can see the diagram of the female reproductive system and all. So there is a part which is called your uterus, and uterus is further also divided in three parts. There is like fundus, body, etc. And this part is the cervix. So it is above the vagina and below the uterus. Next, because we are dealing with the topic cervical cancer, so I want to share some data which is according to WHO. So, according to WHO, what is cervical cancer? Cervical cancer develops in a woman's cervix, which is the entrance to the uterus from the vagina, and almost all cervical cancer cases, 99% are linked to the infection with high risk human papillomavirus, which is also called HPV, an extremely common virus transmitted through sexual contact. So it is a disease which is caused by the sexual contact or the by the infection of the HPV virus. Next, although most common infections with HPV resolve spontaneously and cause no symptoms, persistent infection can cause the cervical cancer in the woman. Cervical cancer in the fourth is the fourth most common cause of the cancer in the woman. In if we talk about the data, like in 2018, estimated about 5,70,000 women were diagnosed with the cervical cancer worldwide, and about 31 3,11,000 women died from this disease. And if we discuss it more, then cervical cancer is the fourth most common cancer among the women, which I have told you already. If we talk about the data of the 2020, so in 2020 the estimated cases were 6 lakh 4,000, and the new cases were 34 lakh 2,000, sorry, 3 lakh 42,000 deaths are occurred in the 2020 because of the cervical cancer only, right? So this is very dangerous, which is found in the woman, and it can be preventable. Most important thing is that it can be preventable. So women living with the HIV are 6 times more likely to develop cervical cancer compared to women without HIV. So here you can see in this diagram what is happening. Like, first of all, there is the structure. This is the structure of the normal cervix where the cells are very normal. Then when the cancer is initiated, so this is the initiation stage. After that, what occur? The mild dysplasia occur. So mild dysplasia convert into moderate dysplasia and then severe dysplasia. After severe dysplasia, the cancer develop and the carcinoma in situ develop, and then invasive cancer occurred. So invasive cancer can be spreadable to the upper body part as well as lower also. So this is the basic idea of what happens in the cancer. If we talk about the India, so in India what happened, like cervical cancer contribute to approximately 6 to 29% of all cancers in the women, and the age adjusted incidence rate of the cervical cancer varies widely among registries. Highest is 23.07 per 1 lakh in Mizoram state, and the lowest is in 4.91 per 1 lakh women in the Dibrugarh district. So this is the data which is very important to know what is happening in India about the cervical cancer. So cervical cancer, like India accounts for the highest number of the cervical cancer. This is very important to know. I have seen a interview also of a doctor where I found that cervical cancer is the very much common in India, and Asia and India. Asia is the largest having cases means, and India is the one most biggest country which is having more than cases as compared to other countries, right? So in India there are very much cases are found. So what are the causes? Causes are very common, like HPV virus is playing very most important role, and other factors also like lifestyle, environmental factors, and also determine the cervical cancer causes. So risk factor is like early marriage and sexual contact with the uh, if the girl is or boy is active in younger age, so there may be chances having, if anyone is having multiple partners, then there is chances, then there is a cervical cancer. Then if there is a chances, if the woman is having weakened immune system, then OCPs are the and HPV infections are the most common risk factors which has contributed to the cervical cancer as well. So what you have to see, like the warning signs of the cervical cancer which you have to see in the girls or any woman which you are going to see in your journey, and you have to assess them, like unusual vaginal discharge or abnormal vaginal bleeding or heavier or longer menstrual cycle, discomfort while urinating, loss of bladder control, then pain during intercourse, constant fatigue, pelvic pain, leg pain, right? So if there are the chances, if there is signs present in the woman, so it should not be ignored. There must be screening or diagnosing for the cancer. Next, we have already discussed it. So what are the types of the cancer? So we have two types of the cancer, like squamous cell carcinoma and adenocarcinoma. So squamous cell carcinoma is what, like this type of cervical cancer begins in the thin fat cells, squamous cells, which are called, lining the outer part of the cervix, which projects into the vagina. Most cervical cancers are squamous cell carcinoma. And next is your adenocarcinoma. So what is this type of cervical cancer begins in the column shaped glandular cells that lines in the cervical canal. So both are the cancer which originates from the lining of the cervical cancer, but adenocarcinoma is the type which arises from the glandular cells, right? So next stages of the cervical cancer. So there are four stages of the cervical cancer. So here you can see, this is the normal cervix, then early stage, then your late stage and stage last, where the cancer has spread to the upper uterus part as well. And one most thing is that there are, if we talk about the grade system, so there we are having grade 1, 2, 3. So in grade 1 what is happening, so in grade 1 the cells are which are which are occupying with the cancer are one third, then two third, then three fourth. So cells are increasing which are involving to the cancer, means which I have shown the diagram, you dysplasia also, that is happening here. And in last what happened, there is invasive cervical carcinoma cancer. What is that, like the cancer is spread to the lower part as well as upper part of the body. If the cancer is spread to the upper part of the body, it can happen in the liver carcinoma can cause, then if it circulates from the upper part it can cause lung carcinoma as well. And if it goes below, then there may be chances of the rectal carcinoma or others. So screening and diagnosis of the cervical cancer. So first of all we will go for colposcopy. And what is colposcopy, right? In this we utilize a low powered microscope to view the cervix and vagina, so the doctor can locate any abnormality and biopsy the area. However, a biopsy can be performed without colposcopy also. Next, endocervical curettage, which is called ECC as well. So it is produced in which the mucous membrane of the, it is a procedure in which the mucous membrane of the cervical canal is scraped using a spoon shaped digital, which is also called curette. So if you have seen the instrument which is called curette, so with the help of this we used to scratch the mucous membrane, and it is tested then under the microscope. Then next is conization. So conization is what, it is a technique wherein tissue is removed from the cervix in a cone shaped for diagnostic or treatment purpose. Loop electrosurgical excision procedure utilizes an electrical current wire loop to separate the subject tissue from the cervix for the diagnostic or treatment purpose. Next, we will go for pap smear. So, you will be familiar with the pap smear if you have done your duty in the gynae ward or in the OPD. So, pap smear is basically a procedure or a test in which we take the sample from the cervix or inner part, and we send it for the lab for the testing that there is a cancer or not for that. Next, diagnostic technique for the advanced stages of the cervical cancer. There we can go for the nuclear medicine imaging, full body CT scan, full body MRI, PET scan. Next, intravenous urography and IVP. Surgery and pharmacological treatment. So, cryosurgery means what we will do in this, nitrogen liquid is injected from inside a metal probe, destroy cancer cells by freezing them. So we are here destroying the cells by freezing them. Then next is laser surgery. So in laser surgery, what we done, like abnormal cells are destroyed through the vaporization. Next, hysterectomy. So hysterectomy means removal of the uterus using laparoscopy procedures. Then tracheectomy. So in this method, used to remove cancer and still maintain fertility. The uterine cervix is removed, but the uterine body is preserved. So there is difference between hysterectomy and tracheostomy. Sorry, not tracheostomy. Tracheectomy. Tracheostomy is the another procedure. Next, we will go for pelvic extubation or pelvic evacuation. So a radial surgery that remove organs from the urinary and gynecological system. Radiation therapy, we will go for chemotherapy, brachytherapy, and hyperthermia. So in hyperthermia, what we do, we increase the temperature of the body. So it works as like increasing the temperature for destroying the cells, like that. So how can it be prevented? So vaccines are present for this, and uh, vaccination should be done to the all the girls like age under the 15 to 19 or under the 40 year of the women. They as vaccination are present. So vaccination against HPV and screening and treatment for pre-cancer lesions is cost effective way to prevent cervical cancer. Cervical cancer can be cured if diagnosed at early stage and treated properly. Then comprehensive cervical cancer control includes primary prevention like vaccination, then secondary prevention like screening and treatment, and then tertiary prevention like diagnosis and treatment of invasive cervical cancer and palliative care. To prevent cervical cancer, WHO recommend vaccinating girls aged 9 to 14 years when most have started sexual activity. When most have not started sexual activity. So before starting sexual activity, the vaccination should be done to every girl. And one more thing, the vaccines are so costly. So if the government want to immunize all the children, that then it should be merged with the immunization program as well, and the cost should be cheaper so that everybody can afford this vaccine. This can be done, I think, with the government. Then some countries have also started the vaccinating the boys as well to prevent the HPV infection. So to reach the threshold, according to WHO, in 21st we have a formula that is 90, 70, and 90, and this is target by 2030. Takka. Then in this what happened, like 90, 70, 90 means 90% of the girl fully vaccinated with the HPV vaccine by age 15. 70% of the women are screened with high performance test by 35, and again by 45 year of age, and 90% of the women identified with cervical disease receive treatment. So this is a 90, 70, 90. This approach should be done according to the government to prevent this, and by the year 2030. So single vaccine shot protect against cervical cancer. A women expert panel concluded that a single dose of the HPV vaccine has efficacy comparable to that of the two-dose regimen, which could help boost cervical cancer elimination efforts. So this is all about today's lecture, which is on cervical cancer. So yeah.